Hi guys, and welcome back to this short video on the topic of rosettes. So this is a short note, and you are also asked some questions regarding this in the Viva. So what is a rosette? It is basically radial arrangement of the cells in a spoke or wheel-like pattern around a central core. So there is a central core around which the cells are arranged in a flower petal-like appearance. Now the question arises that what is the difference between a true rosette and a pseudo rosette? Now please understand that pseudo rosette means that if in the center you have a blood vessel, ओके क्योंकि सेंटर जो है वो यूजुअली इन अ ट्रू रोजेट दैट इज यूजुअली एम्प्टी और यू हैव न्यूरोपिल. ठीक है, दिस इज व्हाट इज प्रेजेंट इन अ ट्रू रोजेट. सो इफ इट इज अ ट्रू रोजेट द सेंटर विल नेवर हैव एनी ब्लड वेसल. इट विल हैव ईदर न्यूरोपिल और जस्ट लाइक दैट एम्प्टी. ठीक है, सो इफ इट इज नॉट हैविंग एनी ऑफ दिस एंड इट इज हैविंग ब्लड वेसल इंस्टेड, देन इट इज गोइंग टू बी अ स्यूडो रोजेट. ठीक है, तो जस्ट क्लियर दिस कंफ्यूजन वंस एंड फॉर ऑल दैट इफ यू हैव अ ब्लड वेसल इन द सेंटर, दैट्स गोइंग टू बी अ स्यूडो रोजेट. Now these are the different kinds of rosette. I'll just come back to that image. So the types of rosette very quickly. Number one, flexor winter Steiner rosette. What happens is that the lumen here is formed by cell borders and fine cytoplasmic extensions. As you can see that these are the cytoplasmic extensions, and there is a cell border which is making basically the lumen. So what is happening in the center, you don't even have the neuropils. ठीक है, so neuropils, what is neuropils? Neuropils is basically the cytoplasmic processes of the nerve cells or the neuroglial cells. ठीक है, that is what is neuropil. They are basically the cytoplasmic projections or the processes of the nerve cell. That is basically the neuropil. लेकिन neuropil जो है वो flexner winter Steiner में neuropil भी नहीं होता है. As I said, true rosette में there can be two types. It can either have a neuropil or it can be completely empty without even a neuropil. ठीक है, तो flexner winter Steiner में there is no neuropil as you can see in the center, and these are the tumor cells. So no neuropil. The hyper-eosinophilic border, as you can see, it is made in the center by the cytoplasmic processes. ठीक है, तो यहाँ पर एक border जैसे create होता है. There is no accumulation of the processes. So examples is retinoblastoma. This is the best example, and then you also have pinealoblastoma and medulloepithelioma. Next one is the Homerite rosette. यहाँ पर you are going to get the neuropil. So as you can see, these are basically the cytoplasmic processes in the center. So the center is not completely empty. Here you have the neuropil. ठीक है, so lumen contains the neuropil, which are the neuronal processes. Now examples: neuroblastoma, medulloblastoma, PNET or primitive neuroectodermal tumor. Next one is a perivascular pseudo rosette. So this is going to be pseudo. So what I said in the pseudo, what will you have? You will be having blood vessels. So as you can see in the image very clearly that there is a central blood vessels, right, with tapered cytoplasmic processes around it. So there is neuropil surrounding it. Neuropil is present, but you have a blood vessel, and once you have a blood vessel, it is becoming a pseudo rosette. So perivascular pseudo rosette. Vascular means around a blood vessel. ठीक है, तो यहीं पर नाम का मीनिंग भी क्लियर हो जाता है. What are the examples? You have a ependymoma, central neurocytoma, and glioblastoma, right? So now coming back to these images, whatever I've shown, that is what is written over here in this image as well. So this was a very short topic. Doubts जो कि है मैंने यहाँ पे address कर दिया है. So just go through this and that will make your short note. Okay. So thank you for watching.